This month makes 4 years since COVID came on the scene, and all of our protocols changed in the hospital. Suddenly, we were telling people that we didn't know how to treat symptoms that looked respiratory in nature. We told people, stay home, come in when you turn blue, when you have trouble breathing, and then we will give you an experimental test to determine if you had said infection, and then give you another experimental medication that nobody was collecting data on. Guys, I know it's been a long 4 years, and many people have asked, where are the nurses? Why aren't more people speaking up? When my story released, it went viral. There was 5 million views on just YouTube alone within a day. YouTube was censoring the content. Social media was banning people from sharing my whistleblowing story. And everybody asked me, why weren't you afraid? I feel like you risked your life. And I did. I mean, when I exposed what I knew to be true because I had seen it and read it with my own eyes, and we're going to get into that today, I did it with a unrelenting faith in God because He put that on my heart to share and to expose it to the world. And so many people looked at me and hailed me as a hero. Now, I've never, ever thought that I was a hero. I was just following my ethical principles. I was following faith over fear. And I didn't care what came from that. People ask me all the time if I have death threats, and thank you. And you know what, guys? I don't think I got any death threats at all. And that's because the world was thirsty for the truth. People then asked, why aren't more nurses speaking up? Well, you know what? Not many nurses had the platform that I did. My whistleblowing story was released with James O'Keefe, and he had a very large following, and it was shared out because of that. But not many people took the same stand that I did. But that doesn't mean that they weren't doing amazing things for their community, for their patients that they came across, and for society. There were a lot of nurses. And my guest today, Ken McCarthy, gathered those nurses, right? There were many, but just a few nurses he gathered, and he wrote the book, What the Nurses Saw. And one of the nurses, Kimberly Overton, who's your host on Wednesday's episode of Nurses Out Loud, she has a chapter in that book as well. And he had reached out to me, but things were going so crazy. But I'm glad that there was another nurse that filled that chapter, because there are so many courageous nurses out there that have spoke up. And today I am joined with Ken McCarthy, the author who gathered those nurses in the book, What the Nurses Saw. So thank you so much, Ken, for gathering the nurses and writing a book for the world to see, because there were so many different nurses in different areas of nursing that you collaborated with and came out with this book. So I encourage you all to get a copy of this book and share it with your family and friends. These are true stories, from the nurses and what they saw and what they did about it. And also my copy of the book, Rare Courage, Standing for Right When You're Surrounded by Wrong. Both of these books will be in the bookstore at americaoutloud.news. And you can also get the books on Amazon. So thank you, Ken. Thank you for joining me today. I'd really like to get your take on what led you to gather the nurses to tell their stories.
Well, I first saw Erin Marie Olszewski
Mhm.
uh, had media appearances, and I was very interested in her story. And there were a lot of questions I wanted to ask her that the journalists weren't asking her. And I got through to her finally. It was difficult to reach anybody like you or Erin Marie. You were busy. You had a lot on your plate, and it was hard to get through. I luckily finally got through to Erin and interviewed her in depth. This was in June of 2020. And I had a lot of technical questions for her about invasive venting, intubation, and some of the things that she experienced in the hospital as a contract nurse up in New York City. I grew up in New York City, and so hearing that a city-run hospital was a disaster doesn't surprise me. And I initially thought it was a one-off. Maybe this was a city hospital. It was highly politicized. You had Governor Cuomo banging the table, wanting more and more vents. And so I kind of waited to see if anybody was going to go deeper into the story. And I also, that same summer, I interviewed a UK nurse. He's a PhD with over 40 years of experience. He's a nursing educator as well. And he gave me the UK version of what was going on. And I had long interviews, and I filed them away. And I thought, okay, someone's going to write a book on this someday. And I look forward to reading it. And then, the year ended, no book came out. 2021, no book came out. 2022, no book came out. It's like halfway through 2023. And I said, I don't think anyone's going to write a book about this.
Yeah.
So using the first two nurses as my leads, I got introductions to other nurses and I interviewed them in depth too. And as you pointed out earlier, they're from all branches of medicine. We had neonatal, we had people working with the elderly, all kinds of different nurses from different states. We had some nurses from Canada.
Yeah.
And slowly it began to dawn on me that the things that Erin was describing as going wrong in the New York City hospital went wrong throughout the entire country. And then as I talked more and more and more, it became obvious there was a specific protocol that was designed, promulgated, and enforced with an iron fist around COVID. And then I started doing some thinking. I'm like, if they did this to everybody, how many of the people who supposedly went into the hospital and died of COVID actually died of the protocol?
Yeah.
And I'm kind of familiar with medical corruption. For some reason, it's a hobby of mine to read books about the corruption of pharma as a whole. Some people have a few books. I have shelves of books on the subject. So this wasn't a surprise or a shock to me. What was a shock, again, is when I started to sit down and look at the numbers, and they said, well, they tell us over 1 million in the United States died of COVID.
Mhm.
Uh, Over 92% of those people died in a hospital
Yeah.
or a medical facility. Well, that may mean there's at least 900,000 plus deaths that need to be looked at.
Mhm.
So maybe we should shift to what the protocol was and how the nurses that I interviewed fought back.
Yeah,
Um,
definitely. Because, like you said, there was one protocol, and I'm suing the HHS. So a judge bifurcated my case with my allegations of gross mismanagement, specific danger to public health and safety. With my whistleblower retaliation, they finally
mhm,
fired me 15 months later,
mhm,
after a judge twisted their hand. And that's the question that we're seeking. Why did you prevent physicians from practicing medicine? Where was this protocol? How come overnight hospitals changed and we didn't medicate people with steroids, you know, albuterol nebulizers, antibiotics to prevent secondary infections? Why did we tell the public to stay home until your immune system is so ravaged that you're going to come in the hospital and have this one medication, remdesivir, which now is fully FDA approved, which is mind blowing to me. But so many people, I think, know now, about it. They understand about, getting treated prophylactically with a variety of different things, right? And people are aware. But what did you find? You interviewed nurses through all different areas of nursing, right? And
Yeah.
different countries.
Yeah.
I know Sarah Jejunian. She was an amazing nurse that did speak out. She's from the Canadian Frontline Nurses. But yeah, what did you find was this protocol? What did people talk about concerning that?
Well, before I answer that question, I'll probably be sharing this video with my own subscribers. So
Mhm.
I want to do a pitch for what you're doing, which is you've got this lawsuit going, and the discovery part of the lawsuit could answer some of these unanswered questions because there's still a lot of unanswered questions, which we'll get to a little bit later. So your lawsuit's kind of the point on the end of the spear right now.
Yeah.
And for people that your following knows who you are, obviously, but for other people that see this video, how can they support your lawsuit, your work, what you're doing? I think that's really important.
Well, thank you for that, Ken, because now we are in the deposition phase, and my attorney, Mike Yoder, who has just been an angel, willing to fight and willing to not settle when in June of, no, not June, it was November of 22. We met with the agency and the federal judge, and we said we're not settling. And it took him 8 months to, come back and say that I had non-frivolous allegations subject to further proof. And now we're in.
That's what the judge said.
Yes,
Yep.
yes, he said that in July of 23, and then the lawyers for HHS all got fired. And so then they had a new team, which delayed it. But now, we're in the month of April, and now depositions are happening. And, those depositions cost money. I wasn't aware how expensive it is, but you have to pay for a court reporter and a videographer who will certify the evidence. And that's looking to be about $12,000. As far as, donating, if you go to citizensag .com, you can support Mike and his work there. That money will not be used for my case because this is already outside of it. But essentially, what he has created is a citizen attorney general's, right?
Mm.
We're
Mhm.
supposed to go to our attorney general, and that's where I had directed a lot of people that were, not happy with the deaths of their loved one in the hospital to go to the attorney general. But no attorney generals are picking up the case. I mean, even here in Arizona,
Yeah.
we
Oh,
have our Arizona Senate that have these COVID committee hearings. But, again, where is that all going? Nobody's doing anything. We're talking about the same thing over and over and over again and getting sworn evidence and testimony that it's like, no, we need to call the hospital administrators, the county public health officers, and subpoena them and have them come and testify. Then those things will make a difference. But it seems like my attorney, Mike Yoder, on yoderesq.com, he seems to be one of the only ones that are willing to fight this. So, I want people to support Citizen AG, because now more people will come forward if they know that they at least have their attorney fees taken care of and court fees. As far as me, I thank you for that. I am back in the ER working, and I can pick up shifts, some extra shifts. So I'm covering, I'm covering the lawsuit, and then Mike is donating a lot of his time. But as far as me in general, I don't have my give, send, go anymore. We're just riding with this. But yeah, if you want to go to jodyomalleyrn.com, you can support me by maybe buying the book. and sharing it with people, because it's all a mission to speak the truth and let people know that they're not alone in their thinking. And, maybe all these friendships and families that have been torn apart can heal. I'm hoping that that book can heal them and really can just using my story as a testimony to the faithfulness of the God, Abraham, Isaac, and Jacob that I serve, and letting people know that he will not lead you to the fire and not see you through it.
Gotcha. And I would definitely recommend Jody's book. I've got it in my bookshelf back there. If you want to follow the story, you know, Jody's written a book, Aaron wrote a book, and these are important testimonies. And yeah, your attorney general, so far, we haven't seen an attorney general of any state pick this up. We haven't seen any district attorneys pick this up. They have the power to do it, believe me.
Yeah, they do. I will have to shout out my Arizona attorney, Ryan Heath, the Gavel Project. If you can find him that way, thegavelproject.com. Ryan Heath was a brave attorney that took on my Arizona cases with Mike Yoder. And we went through court. I had the pharmacist sue me and want to silence me. She's suing me now for $500,000. I don't see that going anywhere, but I did have to go to a hearing on the First Amendment issue. She wanted to get me silenced to ever say the pharmacist again. Could you imagine?
Amazing.
Could you imagine? And the judge, he heard this case over 3 days, and he said that it was a close call, that he was almost willing to side with her, but he was afraid of the First Amendment. Like, oh my gosh.
That's big of him. I'm glad he went that way. But when experienced professionals are not allowed to speak the truth about what's going on in the workplace, especially when the workplace is a hospital, we're in serious trouble.
Yeah.
So good that you had an attorney on that. And the reason we're talking about attorney generals and district attorneys and all these people is this is crime. This is murder. In fact, the subtitle of the book, I talk about systemic medical murder.
Mm-hmm.
And let me explain why I'm using the word murder. We have to understand that everybody doing everything is human. The guy that fixes your car, the guy that mows your lawn, whatever. We're all human, and we're prone to make mistakes, honest mistakes. And in a panicked situation, which the powers that be certainly created, they terrorized the public for months about COVID, and then told the doctors it's untreatable, it's instantly deadly, and here's the only thing we know will work, give it to them. I cannot blame anybody that administered those treatments in the early days under those circumstances.
Mm-hmm.
The problem becomes when a doctor kills 2, 3, 4, 5, 6, 10 plus patients, one after another with the same protocol. I think we're now in the territory of murder. That's how I use the word murder,
Mm-hmm.
and why I use it. So let's talk about the murders. As you pointed out, people were denied in the inhalable steroids, right? Which is what you would give somebody with severe respiratory distress. As a matter of course, this isn't new medicine. This isn't wild, let's try something new. This is like putting a Band-Aid on. It's not controversial. It's the standard of care. The other thing that COVID patients, and I put that in quotes, COVID patients were told was they were not allowed to have ibuprofen. They weren't allowed to get anti-inflammatories, which also makes absolutely no sense.
Yep.
I put COVID patient in quotes because the only thing that determined who was and who wasn't a COVID patient was a positive COVID test.
Well, and not even just a positive COVID test. Do you remember when CDC gave doctors the ability to presume positive? Remember that? Based off
even
of
worse.
Yeah.
Even worse. There's so much to this. It's easy to forget. presumptive diagnosis. We don't have evidence, we don't have lab tests, we don't even have symptoms, but we'll just presume this person has this particular disease. Now, the problem with declaring somebody a COVID patient is once a person was declared a COVID patient, they entered an alternate medical universe where all previous medical practice went out the window, all scientific background went out the window, all common sense went out the window. Example, not giving anti-inflammatory to people with an inflammatory condition, not giving inhalable steroids to some, which is a known therapy for lung breathing distress. That made no sense. There was no scientific basis for it. There was no medical history of not doing that, and it made no common sense either. So people were, it's like if a fireman was called to a fire and they were told, well, don't throw any water on it yet.
Yep.
Wait till the house is fully on fire, and then we'll start to spray water on it. And that's literally how this was handled.
Yeah, literally.
Yeah. And then the next thing they did to people was the BiPAP thing, which is it's non-invasive.
Well, you know what? Let me add something to that.
Yes,
Not
please.
only don't put the fire or don't put water on the fire, but hey, let's use this powder that we've never used before and maybe try to put that on before we do what we know actually works. Right?
Gotcha.
Yeah.
And it's so great to be interviewed by a nurse who lived this, because we can really get into it, in ways I can't with other people that interview me. I want to add another twist to what you just said, since we're on this. What if that powder made the fire worse?
Yep.
Okay. And after it made it worse 3 times in a row, you kept using it.
Yep. There you go.
This is, folks, we're not even exaggerating. We're not stretching anything.
Nope.
We're just explaining how it went down. So going to the BiPAP. So BiPAP is non-invasive venting. What is venting? Venting's basically, normally what happens is your diaphragm descends and that creates a vacuum in your lungs. So there's room for air, and the air just naturally comes in. You don't really have to do anything to breathe. It just, as long as your diaphragm's moving, you're going to breathe. And the lungs are gentle. I mean, they're delicate, and they're strong enough to do what they have to do, but they're delicate, and they're not used to having air pumped down at a rapid pace, and you can actually injure somebody's lungs that way. But if they're truly dying, if it's truly an end of, hey, this guy's going to go, we got to do something with last ditch effort. Well, of course you do it for a short time. But what they were doing was, once you were declared a COVID patient, and then they wouldn't treat you with normal treatments, so you got worse and worse and worse, they'd throw a BiPAP, which is non-invasive, but it's a big mask, goes over your face, it's tied on really tight, it's extremely uncomfortable. It's been described to me as you're driving in the car and you stick your head out the window when you get 60 miles an hour, the wind's just pouring down your throat. Under normal conditions, you would tell the patient, hey, you're having a lot of trouble breathing. We want to help you. We're going to try this out. It's not comfortable. We just want to warn you in advance. Don't panic. It's okay. We're going to be here. If you have any trouble, let us know. We're right here. That's not how they did it with COVID patients. They just slapped this thing on. They didn't explain to them what was going on generally, and they weren't even in the room with them 90% of the time. So now put yourself in the patient's position. They're not feeling well. That's why they end up in the hospital. They think they have a deadly disease that's incurable, that's going to kill them. Now they've got this mask slapped on them. It's very uncomfortable. It kind of makes breathing very weird and difficult in a weird way. And instead of being comforted and nursed, they are left in a room by themselves. So a lot of them became anxious and agitated. I think I probably would. Yeah. And then out came the sedatives and the tranquilizers. Oh, Miss Jones, you appear to be agitated. Would you like something to help you calm down? And that began a stream of tranquilizers. Which, what do those do to your breathing? It reduces your capacity to breathe because it relaxes your diaphragm. And so now the person They haven't been treated for the inflammation. They haven't been treated for the lung distress. They've had this anxiety-provoking so-called treatment given to them. Now they've been given all these sedatives, which making them kind of woozy and affecting their breathing. Now they're told, "Oh, we've got this magic drug called remdesivir. We tested it for 6 whole weeks, and we believe it's the best treatment of COVID imaginable." And most people said yes because they didn't know any better. Why would they say no? Um, for people that don't know this, remdesivir is a failed Ebola drug.
Yeah.
And one of the things that was happening with people that had Ebola was they kept saying that the virus was causing dramatic organ failure.
Mm-hmm.
And I'm now wondering if the organ failure actually was caused by the remdesivir. But whatever went on in Africa with Ebola, they stopped using remdesivir. They stopped giving it to people.
They actually stopped that trial. After 6 months, they stopped that trial because more than 53% of the patients died. And then the other drugs, like Regeneron, which, had better outcomes, those were the drugs that the government, held on tight to. Remember, there weren't very many people that even qualified, quote unquote, to get it. And then when that patient was in the hospital, we removed the advocate. So that patient was alone, struggling to breathe, not knowing the day and time. They're not eating, they're not drinking appropriately, they're not given anti-inflammatory drugs, they're not given nebulized albuterol. You're right, Ken. There's so much that had happened. Well, we need to take a break, but before we do, I really want to take a moment of silence here because it's just so hard. Sometimes I'm sorry. You talk about it so much, and gosh, sometimes it just hits me like it was yesterday. And I know so many of you are out there that have lost loved ones. And I hear you guys, you reach out to me thinking that you could have done more, you should have done more. Your loved one is dead because you didn't speak up. But guys, I really, I want to take a moment, like I said, of just remembering all the people that perished because of it. And these numbers, there's way more. There's way more numbers from people that passed away because of not getting treatment for other things, people that were afraid to go to the hospital for other things that were bothering them, their diabetes, alcohol, all of this stuff. I mean, like you said, Ken, we can go on and on, but for those of you that are here and listening and living still, I just want to provide you with a little bit of comfort and knowing that none of us pass away from this earth until it's our time to go and God calls us home. So I want you to just imagine this life is so short. This journey that we're here on earth is just a blip of time through eternity, and we will all perish and we will all leave this world. And your loved one is not struggling anymore, they're not suffering anymore. God called them home for a reason. And for us believers in Yeshua, we are to live as lights in this world. And any anxiety, depression, guilt that you are feeling right now, I command that away from you in the name of Jesus, because that is the work of the enemy. That is what the enemy wants you to feel. You are here to be joyful and to live the life and to spread the love and kindness and the truth to people. So I just want to take a few seconds and we'll go to break, and then I'll see you on the other side. Whew. Welcome back, guys. You are listening to Nurses Out Loud, and I'm your sniveling, crying host, Jody O'Malley. Oh man, that was deep, Ken. Uh, if you're just tuning in, I am having a conversation with the courageous man, Ken McCarthy, who gathered the nurses to write the book, What the Nurses Saw. And we were just going through some of the series of events that led to this medical mismanagement and subsequent death of millions of people. And I just had a moment, but all right, Ken, I'm just going to give this to you while I just take a few breaths here.
Sure. Following up on what you were saying, I remember when my father died, somebody said, and he was sick towards the end. It wasn't great at the end. And somebody said, well, he's beyond harm now, so that comforted me a lot. It's not great to see someone you love gone, but the truth is they are beyond harm, and we're still here, and our job is to do the right thing, and as you point out, enjoy and celebrate this beautiful life we have. It doesn't help to walk around, with a long face all day, not easier said than done, I understand, but we're alive, and the way to honor the dead is to live fully,
Amen. Yes.
and do the right thing, So I have to address this. All the nurses that I spoke with are willing to talk about what happened, and it's painful for them. It's hard. It's probably comparable to combat. It's different in form, but you're seeing death. You're seeing tragedy, and unfortunately, as in combat too, you're seeing pointless death, errors, mistakes, arrogance, ignorance, stupid things that shouldn't have happened, and it's traumatic.
Yeah.
And I noticed when we've done a couple of shows where I've had the nurses with me, and I started to notice, it's hard to tell the story over and over again. And there are a lot of people in combat who's gone through combat. In fact, I'd say most of them, they don't really want to talk about it ever.
Right.
They're
Now
not
I
coming.
understand. Now,
Yeah.
now I can really understand. I always thought, like, why don't the vets want to ever talk about what they saw, they saw and what they did, and they took it to the grave, so many of them, where now I understand it's not easy, especially when you were complicit in it. And and I think for many nurses and doctors, they were complicit in the fact that they were more concerned about their paycheck and their license, right, than they were about what they were seeing. Because why, I know so many. I mean, I work in the ER now, and thankfully I'm there not as whistleblower Jody, but I'm there as just Jody RN. And a lot of people, well, they don't know my story, and the few that have recognized me, thankfully, are keeping it quiet, because I just tell them, like, I just want to be Jody the nurse, and they respect it. And that is very odd, Ken, right? In a community like that, for them to stay silent, and not tell people, like, hey, you know what she did? Nobody's saying that. But having said that, they don't know that I'm a whistleblower. And what I hear from them, they all know that it was wrong.
Yeah, and the reality is, you spoke up, the nurses in the book spoke up. There are other nurses who didn't make it to the book, and I'm meeting them all the time, who spoke up. But we have to face the reality that it was a small number who spoke up.
Right.
And this is the case in every profession, with every mass misdeed going on. You have a company. How about, let's talk about Enron, if anybody's old enough to remember Enron, supposedly the greatest company that ever lived, and it turned out the whole thing was a scam. Well, there were tens of thousands of people who worked for Enron. You mean to tell me only like 2 or 3 people knew what the scam was? So this is the way of the world. You know, it's the way of the world. It's a few brave people that will stand up and take the heat, but they do exist. And what I find that the nurses are doing now, and then we'll get. I want to get to the protocols so people understand more about it, so you can avoid this happening to you or to a loved one, because this is not over yet. The peak of COVID is over, but 1,500 people per week are still dying of quote dying of COVID in the United States. So, and I hate to say this too. I know there's a lot of informed people listening to this. I am after the book came out. As you can imagine, I'm getting a flood of stories from people. There were plenty of informed people. They knew the masks were BS. They knew the vaccines were BS. They knew Fauci was BS. But they were sick one day and they felt they needed to go to the hospital and they got swept up in it and they were killed.
Mhm.
So don't think that having a little knowledge is enough. You need a lot of knowledge. You need and that hopefully that knowledge will give you the backbone to say no. But what I've noticed, what the nurses like to talk about now, these nurses in particular, the ones in the book, and you, is the positive things you're doing now. You've got your lawsuit, which is of great importance because it might be a way to get light on what actually happened at the highest levels of this. And then a lot of the nurses are creating alternative nursing
Yeah.
care where they run their own show. They're not answering to the hospital or to the doctors. They're using the skills and the empowerment they have legally to practice as nurses, and they're helping people directly and more humanely than the medical system. So that's one of the fun parts of this book is to see what all the nurses have been doing
Yeah.
afterwards.
Yeah.
But it's hard for all of them to talk about it, to think about it. They want to get on and do the positive thing now. But let's talk about more about this death, what I call the death protocol. So if someone's just tuning in, basically once you were declared a COVID patient, you entered an alternate medical universe, where all previous medical practice was thrown out of the window. All scientific, validation of practice was thrown out the window. All common sense was thrown out the window. And the protocol began with, as Jody pointed out, a really important part, which is saying, well, if you only have a small problem, go home. We're not even going to give you anything, and come back when you're really, really, really sick. And then if you did come back, they wouldn't give you anti-inflammatories. Unheard of in medicine,
Yeah.
never happened in the history of medicine, going back 5,000 years to China. Even if they didn't have ibuprofen, they'd give you some herb or something. If you've got
Something.
if
Yeah.
you got
Well,
inflammation,
and two, Ken, we have to remember, because I think how this was able to promulgate was because we told their loved one that you cannot come in. You
right.
cannot come in. And I, as hospital supervisor, would ask them and say, if you want to come in, like I was just begging for people to demand that they wanted to come in. You know what I mean? But so many of them were like, okay, and they just followed the rule. So that I want to, really address that. If they ever try to remove you from the bedside again, be more insistent and persistent about it, because like Ken is going to tell you, because I know the protocol is that patient was in the room by themselves. So they didn't have anybody looking out for them. They didn't have anybody pushing on the call light and saying, my mom needs water. My mom needs to go to the bathroom. My mom needs this. My mom needs a break from this BiPAP. That person just sat there, and yeah, so go ahead. So that was the point.
That's a really good point. And every nurse said the same thing. And we describe a lot of horrors in this book, but they said the absolute worst thing was the isolation and denying people advocacy. And I want to say this to people that lost family members in this. Let's say some guys broke into your house in the middle of the night and shot your loved one. Is that your fault? Were you supposed to, arm wrestle 10 guys that had guns? They got the jump on you. What were you going to do? What happened in these hospitals under this protocol is, to me, the equivalent. They jumped people, and they lied to people. They scared people. They terrorized people. They bamboozled people. You cannot be blamed for not doing enough, because I don't think if you tried to enter the hospital, you would have been removed by an armed guard, for one thing.
Right.
So the next, so the protocol began with not giving the normal treatment. So Jody can tell you as a nurse, if you've got inflammation, take an anti-inflammatory. Don't take too many of them. You know, they're not 100% safe. You got to be moderate in your taking of them. You know, don't take 10 Advil, take one. If it's really bad, take another, but you know, don't go crazy with them. But take an anti-inflammatory, right? It's kind of logical.
Take some vitamin D, take some
Just
zinc, take
see,
some C, get some fresh air,
fresh
all
air,
those things.
sun.
Yeah, sun. We told people to stay home, guys, not even to
Yeah,
open up
let's
your
not forget.
window. Yeah.
Let's not forget. And you know, I got
Oh,
to tell you this. I'm reading a book from it was like 1919, and it was about 100 doctors came together to give advice to regular folks, and it was endorsed by the president of the United States at the time. It's an amazing book. And what was the first chapter? The power of being outdoors. And they had a really interesting theory. I don't know if it's scientifically true, but it makes a lot of sense that sunlight kills all the bacteria in the air, or it reduces it quite a bit.
mhm.
So if you want to breathe the cleanest possible air, go out into the sunlit air and you're going to be breathing the breath. And people knew this 100 years ago. It's in a book. It was a popular
Right.
book that sold everywhere. Now, fast forward 100 years, we're told don't open the windows, don't go outside. If you go outside, wear a mask. I mean, we have to remember in California, people were arrested for going to the beach.
Yep. Yep.
And that,
Playgrounds, the caution tape on playground equipment. There's so much, and we do talk about the protocol and what happened. But I really, we only have like a short time left. What I want to like move on and hear what
yep,
was like, I understand you talked about in the beginning that you heard a couple nurses and you were waiting for a book and then you gathered the nurses and then you realized that there was this one protocol that was pushed out to
yep.
everybody. But what has been the impact of this book and what have been your realizations since the book has been out now?
Well, there's a lot to answer there. It's so interesting. You know, when you research a book, you're learning. When you're writing the book, you're learning. When now the book has been out now since October, and I'm learning new things every day. I'm getting a better picture of the scope of this, how many people were affected. I've also had firsthand contact now with lots of family members, which
Mhm.
is something that's not in the book because we were looking at it through the lens of what the nurses saw. But talking with the family members, I mean, just tragedy after tragedy after tragedy. And I want to say this, if you suspect that something wrong happened to your loved one in the hospital, many states you can go and get the complete hospital records for free from the hospital. They're required to give them to you. It's a state by state thing. I don't really know every single state. Uh, Now, if you go with an attorney initially, they will charge you up the wazoo for those records. They will charge you 50 cents to $1 per page.
Yeah,
And some of these records are 2, 3, 4, 5,000 pages.
right.
And you will need to find somebody, and maybe remnant nurses or Graith or some other group can help you. You'll need to find somebody to help you read those records.
Yeah,
And what almost always happens when a family does this, and a person with knowledge and experience goes through the records, is they see, yeah, this was massive neglect, this was abuse, this was murder.
yeah.
Uh, so that's
So
something.
yeah, on that note, my attorney, which I never finished my thought, Ryan Heath, with the Gavel Project, he did file a lawsuit. Sherry Smith is a widow, and he filed wrongful, well, medical murder, essentially, a lawsuit against the hospital for the death of her husband. So there are attorneys out there that are taking on these cases now. But like you said, Ken, definitely you can call the hospital medical records and request a copy of the complete chart. The complete, you have to
Everything.
tell them that.
Yeah,
And then,
everything.
yes, remnantnursing.org, Kimberly Overton's association. Yeah, they have nurses too, or Graith. I mean, like there's a ton of them out there now. Well, not a ton, but there are so many people that there's a plethora of nurses out there willing to do it. When I put the call out, there's an organization called 1000widows.org. And that is an organization that was started here in Arizona. And I have spoken with one of the doctors that was looking over the charts, and I put out a call to nurses if they would volunteer their time to read over charts. So I have a team of nurses that are ready to do it as well. So yes, yeah. So
and it is work and it is time. So if families are able to pay, it's something to pay for, but it's great that some people are willing to volunteer. That's what we need. We need families who can deal with it, because this is hard to get those records. See, the good thing about the hospital, our modern hospital systems, is they record everything, because they want to charge for every breath. If they give you an aspirin, it's $50 or whatever they're doing, But they write down everything, so you'll see every drug. In one family I talked to, the loved one was given 31 different drugs over the course of 12 days. One other family member, the guy was given 3 not doses of remdesivir, 3 entire courses of remdesivir, which brings us to this. At some point, somebody at the federal government level, and this is why your lawsuit is so important. And tell us your attorney's name again. It's Mike
Yoder, yoderesq.com.
And also where people can support him is
citizensag.org. That is to help future lawsuits, not my own, but future lawsuits.
Gotcha.
Citizens AG.
citizens.ag.org. Okay,
no,
here's what
citizensag.com.
.com.
Or org, I don't remember. Citizens.
Try both.
Citizensag.org.
Hopefully you'll figure it out.
Yeah.
But here's why this is so important. At some point, some group of people got together in a room in Washington, D.C., or one of their campuses out of the city, and plotted out this protocol. And they didn't just plot it out, this irrational, anti-scientific, anti-medical, anti-human protocol. They also specifically incentivized it every step of the way. If a hospital admitted you as a COVID patient, they got a big paycheck. If they gave you remdesivir, they got a big paycheck. If they invasively intubated you, and we haven't even talked about that. That's where they shove the pipe down your throat and they give you 10 different kinds of drugs to knock you out. They got paid for that. They even created an incentive for keeping somebody on an invasive vent for 96 hours or more. And when you read my book, you'll see we interviewed a veteran respiratory therapist, 24 years, sterling record. He said, as soon as we vent somebody, we want to get them off within a day if we can. Yeah. We're always testing. We're always seeing, are they strong enough to get off that vent? Why? It's very bad for the health to be invasively vented over a long period of time. So what did these maniacs in Washington, D.C. do? They created a financial incentive to keep people on the vent for 96 hours. So what we have to find out, I don't know the answer. I've talked to many expert people. They don't know the answer. Attorneys, investigative reporters. Nobody knows who this group of people was that sat down and worked out this protocol, incentivized it. Yeah.
Well, I will say this, because these are the questions we have, where in discovery, we're asking HHS for, okay, well, where was the policy that doctors could not prescribe ivermectin? And to date, I'm not sure if we have that little piece of paper yet. So going back and saying this is what they did. What I believe that happened was this whole narrative was pushed. And I don't think, Ken, that we are going to find a document that said that you cannot do this. Yet it was word of mouth. It was word of mouth that started, from the higher ups, maybe at hospital administration, to say, this is what we're going to do. And once you put a price tag on a certain protocol, then more doctors were leaning to go that way. And then when they're told verbally, you cannot prescribe anything else other than this, right? Then, because we were waiting for the vaccine that was the savior. We were waiting, we have the Paxlovid, horrible drug that's out there that has so many different drug-to-drug interactions. All of this was big pharma pushed. So I do not think that there was a document that floated around. Rather, it was told by word of mouth that you cannot do this or else we will get fired, or you, and most people just didn't fight it.
You know how I think it worked, and because I was asking, it started with Erin. I asked her, who runs the hospitals, and she goes, at the end of the day, it's the hospital administrator, who's joined at the hip with the CFO, the chief financial officer. So I think as soon as those CFOs and hospital administrators saw the huge, unprecedented financial incentives for the protocol,
Right.
that's all they had to do.
Yeah.
Once what because then the hospital administrators say, well, don't give them steroids, don't give them anti-inflammatories, because that's going to hurt our bottom line.
Yeah, and there was a couple of studies that came out, right, and said they were later retracted, but it wasn't, mainstream media that, hey, that hydroxychloroquine study, that was, faulty, and they removed it from the Lancet. But people kept doing the same thing because it happened with pharmacists at Walgreens, at CVS, right? All around the world. But, the pharmacists at compound pharmacies, they were filling ivermectin, they were filling hydroxychloroquine. So, yeah, I think it's all about the bottom dollar for them. And I pray to God that my lawsuit exposes that, because I am calling them out on the testing. I'm calling them out on not allowing doctors to practice medicine. I'm calling them out on the deaths that I saw from patients that were COVID, and doctors had tunnel vision. Oh, they're COVID. This is what we do. They weren't looking and assessing the patient. And I had 3 other people that I have evidence of that had secondary lung infections, and they died from those infections, not COVID. So yes, I pray that the Lord is using it to expose it, and I can be very vocal and loud about it. Lord knows I have been for the last 2.5 years. But you know what? We're wrapping up. We're cutting close on time. I'm going to give you, Ken. Yes, What the Nurses Saw. Guys, pick up a copy of this book. It is powerful. And I will definitely have Ken back on here again, because I think there's so much to unpack, Ken, right? I mean, there's so much. But guys, in the meantime, make sure you are listening to us, nurses. Like he said, we are out here speaking the out loud truth 5 days a week. 5 days a week at 10 a.m. Eastern Standard Time. You can find us on AmericaOutloud.news on our world-class media player. You can listen to us on iHeartRadio. You can also download the America Out Loud Talk Radio app, so you can listen to 24/7 coverage with all of our amazing show hosts. And also, all of our shows go to podcast, Apple, Spotify, Google, Pandora, Stitcher, whatever podcast platform you guys listen to us on. We're there. Okay. And we just need you guys to share the show, like it, review it, and, review us and give us, like 4 stars, 5 stars, whatever you want. Even if it's 1 star, review it and let us know, and reach out to us at nurses@americaoutloud.com. We just started, which I'm super excited about, our Friday Q&A with the nurses. So all 5 of us gather together and have a party on Fridays at 10 a.m. Eastern Standard Time to answer all of your questions, comments, and concerns. And until next time, guys, be safe, be well, and God bless.